and there is a local reflex, there is a local arc. At the spinal cord, it what it does, it stimulates directly the motor nerve fibers of the same muscle protagonist. So when it is stretched, immediately it is contracted. So it excites with the glutamates. But at the same time, it also send one tweak to an inhibitor neuron, and which inhibits the antagonistic muscle or the our muscles of the thigh, the hamstring muscles. So it is when the quadriceps is stretched, the hamstring is released, inhibited. So at the same time, there is excitation and inhibition. And this excitation is created by these glutamates, and this inhibition is created by GABA. And so this baclofen is a GABA agonist. So baclofen helps in relaxing the muscles centrally from the nerves. And again, at the same time, this is excitatory for the same muscle. But at the same time, when it is too stretched, maybe when a muscle is very not conditioned, sometimes we see in a senior lady who comes with pain in osteoarthritis. And if we tell her or they or him to sit down, so gradually he is sitting and the muscle is stretching. And beyond the capacity, if it is beyond the capacity, it is overstretched, then what happens? These Golgi tendon organs, they will take that information. These are stretched when it is more. The stretching is more at the ligament. This Golgi tendon organ, they inhibit this protagonist muscle. So what actually does, the patient cannot unable to sit gradually and suddenly he sits on the chair. We have seen in case of osteoarthritis or this type of phenomena, the giveaway feelings. So these Golgi tendon organ, they also inhibits, or this is inhibitory postsynaptic potential. So this is both, and finally what happens? All the time in the synapse, in the postsynaptic membrane, it is fluctuant. There is sometimes excitatory, sometimes inhibitory. So this fluctuant and the addition or the summation of all the excitatory and the inhibitory, so positive and negative sum, and if it is more than 15 millivolt, then only action potential is generated or the muscle at the muscle contracts. So this is a phenomena observed in the skeletal muscle groups. So thank you for listening. There are two types of inhibition. One is presynaptic inhibition, another is postsynaptic inhibition. Postsynaptic inhibition is done by the ঠিক আছে আমি end করে দিয়েছি as so there are some technical errors. Anyway, we could restart again. So in a nutshell, we could understand the pain starts, the journey of the pain starts from the transduction, and then the transmission, and the transmission and perception, but it can be modulated. It can be modulated at the spinal cord level, both by the ascending fibers for the touch, cariness, or the massage, or the lineaments. So those sensations can inhibit the pain. That is modulation, inhibition. Here also the descending pathway, analgesic system by natural opioids, enkephalins, they also inhibit this. So altogether, at the same time, its interconnections to the autonomic stress and those emotional areas are combined to express the pain. And so this is in a nutshell how the pain co-starts and it is perception, pain occurs. So any other question, if you can ask, I can also discuss a little bit if I have got a little bit of time. Okay. Huh? So on behalf of this, Dr. I request Dr. We are from our institute. This is ESI Institute of Pain Management. Thank you for kind listening. And during this lockdown period, we started discussing our classes and to we across the country or beyond this country, we got the opportunity of these newer modes of education and this newer education, and will continue. This institute conducts education program for the pain, that is a fellowship for 1 year. It is conducted by the West Bengal University of Health Science as a government university, and it is a 1 year residential course. We have not only this academics, but we have also a very good clinical service in this hospital, in this institute. We have about 20 beds, indoor patients only for the pain. So the chronic pain patients can be admitted here. We have fully dedicated operation theater for 7 days, 24 hours only for pain. So we have almost important equipments from radio frequency generator, nucleoplasty and ultrasonography, this fluoroscopic guided procedures, everything can be done here. We are doing it regularly. So the exposure of the trainees for the pain interventions, and also not only interventions but the conservative management, that is most important, by not only the pharmacotherapy but also the psychotherapy and the physical therapies. And there are lots of interdisciplinary interaction. There is an interdisciplinary hospital, so we get this information here, this interaction here. And we also have some sort of research activities, and almost all the students who are here, they must submit a project, they must be associated with the research ongoing to create the evidence in India. So thank you all for this kind listening. Please explain a little bit about neo and paleo. So this neo and paleo spinothalamic tract, there is a question. We know the spinothalamic tract means the tract or the bundles of the nerves which connect the superior to the inferior, the spinal cord to the brain. So it is two-way, and this tracks from the spinal cord to the thalamus, or connected with the spinal cord and as also with the thalamus. So it is spinothalamic tract. This spinothalamic tract has two. One is primitive, and our paleo-spinothalamic tract. Another is new or modern, that is another neo-spinothalamic tract. This modern spinothalamic tract, actually it started maybe 1 million years ago, and it is modern. And before that it was primitive or the paleo. So paleo means when it is there in the other animals, other vertebrates, other animals, that in other animals will get the primitive spinothalamic tract. Say for example, the sense of pain is there in the animals too. So the sense of pain in the primitive roads. So you know, in a city we have the roads and lanes, small and big. That is there in the city. That was not organized. The line and lanes were not preserved. So that was in the city. So from very beginning. So that is old, and that is the old paleo-spinothalamic tract, and from through which the lots of vehicles, maybe fast moving, slow moving, a Mercedes Benz also going, a cycle rickshaw is also going in the city roads. So, and there are a variety of information, variety of senses, not only pain, temperature, cold, the itching, the tickling. So those all informations, they travel through these anterolateral spinothalamic tract. So crude touch. So these all informations. This is also the going to the anterolateral spinothalamic tract. The sexual sensations, that also is a primitive. So it also goes through the anterolateral spinothalamic tract. All are very slow, but the sensation of light touch, this goes, and the joint sense. So that when the man was erect, and so there is always tendency to fall. So every time there is competition at the subconscious and also the conscious level to control the muscle movement so that one do not fall. It needs learning from the childhood to stand or walk or run in erect posture. So these muscles, coordination of the protagonist and antagonist muscles, always there are millions of informations, action potentials, feedbacks. They need to go very fast, even at the level of the local level, at the level of the cerebellar level, and even they are not reaching the cerebral level into the conscious sensations or the normal walking. We do not know how we are walking, so this is not conscious. But when there is a slippery road, then you're consciously walking. So these all are, so the unconscious or the automatic gait walking, that is also the joint sense, the how my hand is placed, what is the position of my hand. I will not be able to tell, but once I look, yes, then I am alert, then the consciousness comes in. So this unconscious information, joint sense and those things, they actually travel in the neospinothalamic tract. So this is the difference between the old and so we can end here. Thank you for kind listening. We'll come again.